one hand. When you're doing CPR, you could use one hand for a child. That would be a difference between CPR for an adult and CPR for a child. So an adult, you probably need both hands to press down. If it's a child and the child's 2 or 3 years old, you might use one hand for the child. If the child's 8 or 9 years old and the child's bigger, you may need those 2 hands to press down the 2 inches. With the infant, using 2 fingers. With the infant for 2-person, using 2 thumbs. Any question on the CPR skills?
Where do the thumbs go where? Like like in the middle of the sternum?
They go right in the center of the sternum, right here. Now my thumbs are bigger, so they said you could overlap your thumbs. Because the bone is about, the sternum is about the size of a pen or a pencil. And you don't want to press on the ribs. So right here, your sternum, if you feel your own, here's a clavicle bone, and then here's the start of the sternum. I go down, and right here my sternum ends, so it goes right in here. So it's right here, just like the button line is. So with the infant, it's smaller, and you're going to place your hands there, or overlap your thumbs so you're right up on the sternum. By the way, with the adult, it's the lower third of the sternum. It's the lower part of the sternum. With the infant, it's just below the nipple line, so it's more toward the top part of the sternum. Okay, so let's see what we have for choking here. We saw this one. You saw this video, right?
Yeah.
The boy comes out, he's eating, and then he comes over and helps him.
Now that you're in position,
This would be for the conscious choking person. What's the sound? And he keeps on doing this until the object comes out, or the baby starts crying, or the baby starts breathing. This is for conscious. Now we're going to talk about unconscious infant. That was for a conscious infant.
as with an adult, if a choking infant becomes unresponsive, shout for help. Then lay the infant on a hard, flat surface. Perform CPR with one exception. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. Chest compressions may help move the object so you can remove it. Once you can see the object, carefully try to remove it. Never perform a blind finger sweep. You only want to sweep for an object if you can see it. If you are alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system. So you've learned the proper BLS rescue techniques of CPR, rescue breathing, and treatment of choking, and know how to react in a 1 or 2 person rescue situation. Now you get to show how well you've learned. Your instructor will evaluate each of you.
All right, someone turn the lights on. And the video really doesn't show you or give you a demonstration of what to do if the person is unconscious. Right now I have a person lying down. The scene is safe. I took my PPE precautions. I tapped and I shouted. I checked for breathing. Call 911, we have an unconscious person that's not breathing. I don't know that they're choking. I didn't see them eating something or choking. I don't know whether they're choking. So now I'm checking the pulse. They have a pulse, but they're not breathing. What should I do for this person? Rescue breathing, get my pocket mask. I give a breath. The air doesn't go in. I think there may be an obstruction. Or maybe I didn't give the breath properly. So I'm going to reposition the head, retilt the head, and try it again. I give another breath. Air doesn't go in. Now I'm going to assume there's some type of an obstruction. So I'm going to do 30 compressions, trying to force air out. But the difference between this and CPR is that after the 30 compressions, I'm going to look in the mouth to see if I see anything, if anything came up. If I see something, I'm going to use my index finger to scoop it out. And then I'm going to give 2 breaths to see if they go in. If they don't go in, I'm going to try it again. This would be just like doing the Heimlich maneuver. So I'm giving 30 compressions, but after the 30 compressions, I look in the mouth. I don't see anything, so I don't stick my finger in. I give 2 breaths. Air goes in. Now I'm going to check the pulse. There's no pulse, so now I'm going to start CPR. 30 compressions and 2 breaths. CPR, I don't have to look in the mouth. 30 compressions, 2 breaths, I see the chest rise. Now let's talk about the baby. I have no idea what's wrong with this baby. I just know that there's no response and they're not breathing. So I check the pulse. Baby has no pulse, so I'm going to start CPR. They're going to have an obstructed airway, but I don't know that. So I do 30 compressions. After 30 compressions, I go to give 2 breaths. Air doesn't go in. So I reposition the head, try those 2 breaths again, another 2 breaths. Air's not going in. So now I'm going to do the choking skills, which is 30 compressions. But after 30 compressions, I'm going to look in the mouth. If I see something with my pinky, because if I stick my pinky in, there's room enough for me to look in and still move to try to get it out. Nothing comes out. So I give 2 breaths. Air's not going in. I go back and I try it again, forcing air out, looking in. I see something, finger sweep, object comes out, there's no sign of life. I give 2 breaths, air goes in. Now I have to check the pulse to see what I have to do for this baby. Has a pulse, and the baby's breathing. So I just stay with the baby and monitor the ABCs. They have a pulse, they're breathing, they're still unconscious. So I just stay with the baby until paramedics EMTs come in. There's no special time when you call 911 with a choking person. You have to make that decision. On one of the videos, they said after 2 minutes, if you don't get it out, call 911. I might call it out sooner. You may decide to call right away. You may decide to call when the person goes unconscious. So on your exam, there won't be any questions to say, when do you call 911 if you have a choking person? You have to make that decision. If I had a baby and someone handed me a baby and say, the baby is choking, and I'll say, I'm certified and trained, you want me to help? Yes. And they're conscious. I wouldn't call 911. I'd do 5 back blows. I'd come over here, do 5 chest thrusts. And then I'd say, call 911, the baby's choking, I can't get the object out. Some people might do that for a minute, and then the baby goes unconscious, and then they call 911. So you have to make your decision. I think it's better to call as soon as possible or quicker than later.
Do you only figure sweep for the infant, or do you do it for the adult as well?
No, I use my pinky for the infant and try to scoop it out.
How about
So-
for the adult?
Say that again?
How about for the adult?
After you do the 30 compressions, you look in the mouth. If you see it, you try to scoop it out. If you don't see it, they say do not stick your finger in, because if you don't see it, you're liable to start pushing things down.
Do they swallow it, or do they usually just come out of the mouth?
It usually will come out. You'll either see it, or it will come out, or fly out. Now, let's talk about some things here. When you have an unconscious person, you may not know that they're choking until you give breaths, either when you do CPR or whether you do rescue breathing. When I test you, I will just say, has a pulse, not breathing. So you'll start rescue breathing, but I'll say, air's not going in. You don't start choking skills, you try it again. You re-tilt the head and give another breath. Because the first time you give a breath, it might be that you didn't put the pocket mask on properly, you didn't tilt the head properly. So you always try it twice before you do it. I call obstructed airway skills modified CPR. Because normally CPR is 30 compressions and 2 breaths. 30 compressions and 2 breaths. But when you do 30 compressions, look in the mouth and do a finger sweep if you see it, that's different than CPR. You're trying to get an object out. So if you see someone doing 30 compressions, looking in the mouth, then you know they're doing modified CPR, which is a choking skill to try to get the object out. Yes?
Can you just remind me when you would do rescue breathing versus CPR?